Hello, everyone, and welcome to today's webinar, The Truth About Liver Cancer Survivor Stories. The Truth About Liver Cancer is produced by Blue Faery, the Adrian Wilson Liver Cancer Association, a nonprofit organization dedicated to supporting patients, caregivers, and families impacted by liver cancer, specifically hepatocellular carcinoma, HCC. Blue Fairy's mission is to prevent, treat, and cure primary liver cancer through research, education, and advocacy. I'm your host, Aura Sanchez, and I'm the program manager at Blue Fairy. I'm passionate about health education, patient advocacy, and helping people access meaningful resources like the one you're accessing today. I'm especially excited about today's conversation because we'll be hearing directly from liver cancer survivors and giving them the opportunity to share their experiences in their own words. Today, we'll talk about their journeys from diagnosis to treatment through survivorship, including the challenges they faced and what helped them along the way, and also what they learned from their experiences. Whether you're currently living with liver cancer or cancer-free, or a caregiver, a family member, or you're joining us as a healthcare professional or advocate, we hope that today's conversation leaves you feeling informed, connected, encouraged, and reminded that you're part of this community and that you're not facing this alone. Before we begin, I'd like to thank our incredible panelists that will be joining us today. We're honored to have Jerry Milner, James Buck, Amy Anderson, and Candace Allen, who have generously agreed to share their personal experiences with liver cancer. We're incredibly grateful to each of them for taking the time out of their Saturdays to be here with us today and share their stories and experiences. Before we jump into today's discussion, I want to take a few minutes to review Zoom webinars and how it works so that everyone can make the most out of today's session. Zoom is a little different. It can be a little tricky if you haven't used it before, so I'm going to make sure that you're an expert before we start the webinar. Let me go ahead and share my screen so that you're all able to see it. Okay, awesome. If you are able to see my screen, I would love to see a thumbs up. Hopefully you can see it. Awesome. Awesome. I see some reactions. Great. Okay, so let's talk a little bit about Zoom webinars. Like I said, it could be a little different than what you're used to using if you've never used it before. So throughout the webinar, you're going to be able to ask questions. We're going to leave questions till the very end when all our presenters are done sharing their experiences and telling us their stories. So if you have questions throughout the webinar, go ahead and put them in the Q&A. If you have questions for our presenters, go ahead, put them in the Q&A. For chat, the chat is going to be right next to the Q&A. The chat you can use if a feature on Zoom is not working, if you can't hear us correctly, or if you're just having trouble accessing something, or if you don't understand what a term means, you can go ahead and put that in the chat. So make sure just to use chat if something isn't working properly. If you have a question for our panelists, you can use the Q&A to do that. If you're having trouble hearing us, I encourage you to click the show captions button. That will show you the captions and they'll pop right at the bottom. I encourage you to not raise your hands. If you have a question, again, put it in the Q&A. The raise your hand feature, there's not a way for us to get rid of this feature with Zoom webinars, but please don't use it. Now, the reaction button. You can use emojis to show us how you feel about the content that's being shared, and that's amazing. So we encourage you to use all the emojis, thumbs up, hearts, clapping, or even the party emoji. That would be great. It's a great way for our panelists to know that you like the content that we are showing, and as well as for us to know that you're interested and we can keep providing these great webinars for you guys. And lastly, this session is being recorded, so you will receive an email, maybe not today, but on Monday, you will receive an email once the recording is shared on YouTube. So you have the chance to replay this recording and then as well as other recordings that we've done in the past, other Truth About Liver Cancer segments that we've done in the past. So hopefully now everyone's a Zoom expert. If you are a Zoom expert, make sure you put a thumbs up in the chat. That would be amazing. And or in the reaction button, you can send a thumbs up. And let's see if the chat actually works correctly. If you guys can just tell me, how hot is it where you are? I'm currently in Altus, Oklahoma, and I can confidently tell you it's already 97 degrees. So you can just tell us the temperature of where you are right now. That'd be amazing and a great way for me to know that the chat is actually working. Let me go ahead and stop sharing my screen. Awesome. Let's see, how hot is it where you guys are? 77 degrees. I wish it was like that here. Well, I am officially jealous. It is very hot in Altus, Oklahoma. Let's start there. Awesome. Awesome. Thank you guys for sharing. Awesome. So now that I know that everyone is a Zoom webinar expert, I want to begin and welcome our first panelist to the stage. We have Jerry up on the stage. Jerry Milner started his own business at the age of 21 and spent the next 38 years working and building his career. Everything came to a screeching halt after a freak accident revealed liver cancer in 2018. Due to the early detection efforts that were made to remove the cancer, um, liver transplant was the only viable option. The liver transplant he received was life-saving. He got his liver transplant on November 6th of 2020 in the middle of COVID, and Jerry is now 5.5 years post-op and cancer-free. He will share his health and physical emotional challenges and the importance of a strong support system through the journey. Thank you so much for being here, Jerry. We appreciate you.
Thank you for having me.
Thank you. And so, Jerry, I want, if you can share a little bit with our viewers, what was your experience like with liver cancer? How did all of this begin?
It kind of started out kind of strange. I was on a flight and went to help a young lady get a bag down from the overhead compartment. And it came down pretty heavy and hit me in the abdomen. Over the next few months, I started having some pain, some issues. Uh, Finally culminated in collapsing at a funeral and ended up in the emergency room and 11 days in the hospital. During that process, they did a biopsy on my liver because they saw a hemangioma about the size of a fist in my liver and determined that it
Wow.
was cancer. Then they come back and did another biopsy and said, well, it's not cancer. So we're going to send you to an oncologist just to monitor you and make sure everything gets okay. And then
Right.
my wife and daughter and my grandson insisted that I go to University of Alabama in Birmingham Hospital, which I didn't really want to do because it's an hour and a half each way, and I resisted, and they forced their hand, and so I went, which was the best thing I ever could have done because being there with a group of doctors that understood what I was going through, they did find HCC and they
Wow.
started out putting me through a surgery to remove a large part of my liver. That failed. They come back later and said, you got to have a liver transplant. And after freaking out for a little while, we started that process.
Yeah, I was gonna ask you, I'm like, what was your reaction like when they first said cancer and maybe you weren't too sure, okay, what cancer? What was that like for you?
Well, I mean, hearing cancer, I mean, the first thing that went through my mind is dying. I'd known people with liver cancer, and people just didn't survive, in my mind, liver cancer. And so I started getting my life in order. I started working on preparing to basically not be here any longer. I went through that whole process. I planned everything, made sure everything was documented so my wife would know all the stuff that I did around the house. She would know how that all worked and could do it. And I just did not think that I would make it.
Yeah, no, and understandable. And so you mentioned that it was the best decision that you could have ever made. Even maybe you were a little coerced to go see the multidisciplinary team in Alabama. So what treatment did you initially receive when you first started seeing your doctors?
Well, when we first got there, and I started learning more about liver cancer and the challenges. They started trying to control the size of the tumors so that I wouldn't uh, scale out of the program with the Milner criteria. So I went through multiple ablations, constant monitoring every 3 months with scans and blood work, and it's everything you have to go through because their total focus was on keeping the cancer under control so that I could both qualify for a transplant and then survive one, and not let that cancer get out of my liver. And and the thing that's why I just anybody that is diagnosed with HCC, get yourself to a facility that's got the disciplines because those doctors understand all of your options. You might have a great doctor in your hometown, but it's not the same as being there where they've got, tumor panels and intravenous radiology people and everybody that knows everything they need to do to keep you alive and keep that cancer controlled in your liver.
Yeah, 100%. Yeah, at Blue Fury, we really encourage you guys, any patients that are watching, to please seek out a multidisciplinary team. And if you need help doing that, we can definitely point you in the right direction, of course. Um, Jerry, so what was it like for you waiting for a transplant while your doctors work to keep the cancer under control?
Well, I mean, it was, when I was diagnosed, and about 2 weeks later, we went into lockdown with COVID. So I was trying to work from home, trying to, and quite frankly, and if I'm being totally honest, I still didn't think I'd survive. So I was still trying to get my affairs in order, get my work in order so that, when I could not work any longer and I was done, everything wouldn't fall apart. I had commitments to my employees and to my family and it was a tough time. Plus being isolated, totally isolated with COVID because my wife and I couldn't be around anyone because no really knew what COVID was then. And so we were making absolutely sure. And my doctor said, don't get COVID. We don't know how that's going to impact your transplant program. And so we couldn't be around family, we couldn't be around friends, couldn't do Christmas for the first time, that year that we had ever missed Christmas with our families. And it was just a really tough time waiting. And I called it waiting to die because that's what I honestly thought I was doing.
Yeah, and I mean, COVID on top of liver cancer, also COVID was going on. What did you do to kind of, or what did your family do for you to keep you in good spirits?
Well, I was fortunate enough to have a wonderful caregiver, my wife, and she wouldn't let me give up. She made sure that I still felt positive the best I could. She took care of me because as I got sicker, I mean, being alone, I mean, she was the only one that could do it. And then when I was hospitalized during COVID, she couldn't be in there with me. So it was kind of a lonely time from that perspective. But we went through a pretty tough time. I mean, I got sick. I couldn't, first I couldn't hardly work because I was so tired and then it got to the point where I couldn't sleep for about 3, 4 months before the transplant. And the only way I slept was to get totally exhausted and just basically pass out. And
Yeah.
then all the other problems that come with liver disease that I'm sure most people that have been around it have understood. It changes your life.
Yeah, of course. And I know you mentioned that you were, you were balancing work as well. How did the cancer affect your ability to work and manage your everyday life?
Well, my days are pretty simple. I was able to work from home, but I woke up and threw on something that looked like I was presentable and walked in here where I'm sitting now and turned on conference calls and telephone calls and emails. And I did that for, 4 hours. Lunchtime got here. I went and laid down, tried to rest because I was exhausted, got back up and hit it again after lunch. And 5 o'clock came, and most days I hit the bed because I couldn't stay awake any longer until I got to where I couldn't sleep. Then I was just miserable. And then my wife would, get me up, make me eat something because it was kind of hard to eat and you didn't want to eat.
Yeah.
And then you'd start all over the next day. But fortunately, COVID was there in that respect because, I traveled a lot for a living, 3 days a week usually at least. And if we had not been locked down with COVID, I wouldn't have been able to do my job at all. I'd have been kind
Right.
of dead in the water.
Right. Right. So it was kind of like a positive and a negative all at once.
Right.
And did you try connecting with a community after you were diagnosed with cancer? Did you seek out any, for example, any Facebook groups or any support groups?
Yeah, actually,
Virtual?
I'd never been on Facebook in my life. Didn't want to be on it at that time. But I heard through some people at the hospital there were some really good support groups on Facebook, and I joined Facebook and got hooked up with several groups, and that really helped me learn a lot about because I can tell you that most dangerous thing about computers and social ability and the internet is Dr. Google. Because when you get on there and you start Googling HCC and liver cancer, I mean, it will scare the crap out of you, basically. But those Facebook groups kind of brought it back home because you were reading about real experiences and seeing people who had survived HCC with transplants for 10, 12, 14 years, it kind of started making me think, okay, if I can make it to transplant, if I can survive long enough and keep the liver cancer under control long enough, I can survive this thing.
Yeah, yeah, 100%. I believe that connecting with others definitely gives a lot of hope, which is why I'm so thankful that you're here sharing your story today, with patients and whoever is listening to us out there and has joined this webinar. Now that you talk about survivorship, what does survivorship mean to you, and how has this experience changed the way that you live?
Well, I mean, I think I'm thankful every day when I get up. I mean, the way it's really the most impact it's had on the way I live is that I don't work anymore. I started really evaluating what I wanted to do with my life and my time after I got over this sickness and decided to retire and spend more time at home with my family and not be focused on the day-to-day grind of working every day. And it made me very appreciative of the ability to do that and having the ability to do that. And the new normal for me is totally different than before the transplant. I can't do a lot of the things I used to do, but I try to do as much as I can do.
Yeah, yeah, 100%. And I mean that's okay too. I wanted to ask, what gives you hope today, and what would you want someone that has been newly diagnosed with HCC to take from your story?
Well, I mean, I think the biggest thing to me is the changes, the medication changes, the testing being done to try to reduce immunosuppressants, um, just the technology that's come into the transplant world with some of the things they're trying now. They probably wouldn't have ever got around to benefiting me, but they'll save people in the future. But the biggest single thing I can stress to anyone who is experiencing liver issues in general is that if you get to a point where they suspect there's cancer involved of any kind that's related to your liver, the best thing I can tell anybody is make sure you're at a hospital that deals with liver resections, transplants, because there's a process you've got to go through, and time is not your friend with HCC. You've got to keep it contained in your liver. If it gets out of your liver, there's really nothing they can do for you other than make you comfortable and treat your symptoms at that point. But if you get caught early enough, there's things they can do. A lot of people are cured with resection, but in my case, that didn't do it for me. But transplant is the ultimate cure. And once you get to that point, but you got to be at the right hospital to get there.
Awesome. Thank you. Thank you for sharing that, Jerry, and for sharing your story. And again, to the people that are out there listening to your story, if you have any questions about Jerry's journey through HCC, please feel free to pop that in the Q&A. We're going to be answering those questions at the very end. And for the time being, oh, I see a raised hand. Make sure to, I'm gonna not bring down all the raised hands, and I'm going to ask you guys to put those questions in the Q&A. Thank you again, Jerry, for sharing your journey and your perspective of HCC. We're gonna have you come right back for the Q&A session, and then we're gonna bring James up to the stage. James Buck is an HCC survivor who was diagnosed in July of 2021 and received a transplant April 2023. He credits routine doctor visits and blood work with helping him navigate his journey and continues to prioritize follow-up care. Now back at work full time, James is enjoying life and looks forward to sharing his experience with others that are facing liver cancer. Thank you so much for being here today, James.
Hello, glad to be
Awesome.
here.
So, thank you, James. So, I mean, James, can you share a little bit with us about what was happening in your life before HCC even came into the picture?
Well, I was laid off from the company in 2020 before that due to things from the COVID, and kind of was actually going back to school in early 2021 to get some new IT skills.
Yeah.
And so in that process, that was July of 2021, I got the diagnosis. I was still trying to go back to school and do whatever treatments. So I was thinking, toward the future and getting skills rather,
Yeah.
going back to work.
Yeah, so
Uh,
you had a little plan set up for yourself on what you were going to do moving forward. Um, so I mean, can you share with us how was that tumor first discovered?
I just went for just a normal blood test and showed up elevated liver enzymes. And so they went to ultrasound that wasn't conclusive, then to an MRI that did show it. And
Wow.
so
And yeah, sorry about that. And so when you received, I guess that test back, what were your first thoughts?
kind of the biggest problem ever to solve, to study liver cancer, um, the procedure that they first wanted me to do. So I'd seek to understand what was going to happen. Uh, in my interest in science, I wanted to find out what was going to happen.
Right. And
Um,
so sorry to cut you off, when you got those test results back, were you already um researching and did you already have in mind, I need to see a liver specialist?
Not at all, really. Now that I reflect back on it, I did notice significant weight loss over the period of time years before. But no, I didn't really have symptoms. I mean, obvious symptoms that show up day to day.
Gotcha. And when your doctors discovered the tumor and they said, "Hey, this is serious. This is HCC." Um, did they tell you where it might have stemmed from?
I think later on, I thought it was due to the metabolic thing, the MASH.
Yeah, the metabolic liver disease. Yeah.
Given I was a light, moderate drinker anyway. Um, I think the
Right.
biggest impact at that time, remember, was to my wife getting hit pretty hard. So I wanted to support her too and understand the condition.
Right, right. And I think sometimes I feel like sometimes we don't I'm saying we, I'm not saying you. Sometimes we also don't realize that the caregiver also needs support. So I think, I mean, it's very kind of you to also try to support your wife through, what she's also experiencing, watching you experience. I wanted to ask, before your diagnosis, were you ever aware that metabolic liver disease could be connected to an increased risk of liver cancer?
I was not aware at all. All right.
Wow. So during your routine doctor visits, they never said like, "Hey, James, just watch out for this. It's important that you take care of yourself."
Uh, no, it's just taking care of, hypertension or cholesterol or the usual ones. And so that's why I was already doing doctor visits on a regular basis.
Gotcha. And so, well, how did you respond emotionally when you learned that you had HCC and that you might be needing a transplant?
I'm usually more guarded, with emotions. And actually, emotional impact was after the day after the transplant operation to see what happened. It was real then, you know,
Yeah.
but that's later on.
Yeah, and I mean, you obviously mentioned that your wife, obviously needed support. What were some of the things that you did to support your wife that also was, I imagine, very worried for you?
Um, Constant communication and like, what are we going to do and what's next on uh, treatment options or what to do.
Yeah.
Always aware
What
of,
about, yeah, sorry about that. And what about when it came to your multidisciplinary team, did you seek out the help of a multidisciplinary team? How was it like finding the right team of doctors?
well, I went from my primary care doctor to the medical center, and the first treatment was really they call it transarterial radioembolization. So this radioactive microbeads into a catheter to go up to the tumor to reduce it, not cure, but to give you more time for the expected transplant waiting
Yeah.
list. I didn't have any problem with that procedure.
Yeah, can you take I guess the viewers that are listening right now, can you take them through what it was like receiving that procedure and exactly what it entails for those that are not too familiar?
Well, usually there's two separate visits. The first one is mapping of the liver arteries, and that's also with a radioactive substance, but it's much lighter. So they have to have a map, and then that's catheters in the what is the iliac artery in the groin and right up to the liver. Um, no discomfort at all during the procedure. I didn't have any reaction after it. I mean, not significant at least.
Right, right.
Uh,
Any tips for, I mean, I know that you said you didn't have any reactions, but for anybody who's feeling maybe nervous about um seeking out treatment or attending their first appointment, any helps, tricks that you can advise them to take?
um, I guess part of it's emotional and just being ready to work on the steps needed for your treatment, your for the whatever it may be. Um, so I guess in a way that's keeping positive of how do I work through this and solve it or solve it. Like
Yeah, I
communication with
mean,
the doctor, so on.
yeah, yeah. I mean, I think you some people view it in a way as like, how do I solve this, right? Which is completely fair and understandable. So once you went through that treatment, what came next after that? Were they able to put you on the transplant list, and how did you go about that?
Well, there's a lot of steps to getting cleared for the transplant list. Um, Testing your heart because it's going to be a major operation. Um, there's also a social aspect. What's your support system? Your people? Uh, what's your attitude? I actually had to go through a substance abuse center just to be checked out. You know, I never had that issue. Um, and then the dental clearance, where they have to remove some teeth because that's a possible pathway for infection. And usually the wait list is something like 6 months. Um,
Wow.
and my time to transplant, I think, was shorter maybe than average, given the lack of other conditions, comorbidities, I think.
Yeah, wow, yeah, I think that how long was it that you were on the transplant list?
Let's see, diagnosis in 2021, so active on the list in 2022. So a little over a year.
A little over a year. Wow.
It's still strong, you know, to handle the operation itself and recovery, and which actually went quicker than average, I think.
Yeah, so you were pretty lucky at like hitting those milestones quickly and being able to recuperate. I wanted to ask you in terms of your liver transplant, I hear from a lot of patients that are waiting for a liver that sometimes they get calls and okay, maybe that wasn't the right one. Oh, that wasn't the right one. Did that happen to you?
Yeah, I remember one time I actually went into the hospital, waited overnight, and that's like I was a backup person, and so the primary one got the transplant. So it's like a lot of stress. I mean, it's going to happen, and then nothing. You go home, or you get a call where it's you could be on the list, and then later it's like, no, it's somebody else has it, or it's going to have it. So going to the hospital is yeah, kind of stressful.
Yeah, of
But
course. And when you would receive those calls that I guess, okay, I didn't get it this time. What did you do to kind of handle the disappointment from knowing, okay, false alarm, not this time.
just focusing on the future and how to get to the treatment I needed, transplant, just staying positive and just a little setback and keep moving forward.
Yeah,
Um,
of course.
Funny story about the actual call I got.
Yeah.
Okay, they say carry your phone around you 24 hours a day, 7 days a week, always. And I set my phone in the bathroom, went out to the kitchen, do something, and they actually got a call. I tried my wife, and then actually went to my daughter in another city, and she found out first. Got back on the phone, and that was like a Friday, late Friday, into the hospital Saturday evening. Um, yeah, I just had the understanding of what the doctors would do, and so I trusted the doctors to go through it.
Yeah.
So that's
Did it
also
help you?
definitely. It also has an impact on how the anesthesiologist can moderate your or monitor you if you're not stressed out, and that could affect your that part of the sedation.
Yeah, yeah, of course. And I wanted to ask you, you mentioned a little bit in the beginning that you felt like it didn't truly hit you until you woke up after surgery. So when you finally received that transplant, can you take us through what that was like?
Well, I some people have different incisions, but mine was more of a right angle, and just have all these staples in it, and just became very real at that point. Kind of emotional for me, at least at that time.
Yeah, of course. And was your wife there? Was she there when you woke up?
Yeah, the transplant started around 4 p.m. And so the doctor said, "Oh, you can go home and come back." But actually, they got a call around 11 p.m. that I was done, going to recovery quicker than an average. So I came back, and yeah, it was uh, not too long in ICU and
Yeah.
not as long in the general hospital.
Yeah.
So then my
So you didn't spend that long in the hospital, and I wanted to know what was your recovery like after that transplant?
um well, I had a drainage bag for the surgery because it from abdominal fluid that was retained after, and they regularly used to taking the pills every 12 hours. Even today, it goes on. Um, Very strict about what pills you're going to take, when you take them, um, things about avoiding sun because you're high risk of skin cancer,
Right.
can't eat certain things, certain medications. So it becomes a lot of rules and understanding about those and getting through that part.
Yeah. What about, I mean, now you're 3 years post-transplant. How has your life changed now? Do you have any like new outlook on life? Are you back to work now?
Yeah, back to work. Getting a job was actually hard, and that was a kind of emotional impact. And I went back to the same company in January this year. Uh, and it's
Amazing.
been a great experience for me to get back and start using brain again for actually it's programming. Um, Really getting into various technologies and really excited to be there. So it provided a, I think you should say, new lease on life or something like that.
Yeah. Yeah, of course. And so, I mean, I know the work aspect is really important to you. What advice can you give to those patients who have already had a transplant and are having a hard time maybe getting back to work and finding their job? How did you stay positive throughout that? Was there anything that you did or kept telling yourself?
Um, let's see. Well, sometimes you get a little down about trying to. I mean, the interview process is no fun.
Yeah, of
Sometimes,
course.
uh, and COVID changed that where it's mostly virtual.
Yeah.
Sometimes you just step back and then relax and just think about life in general. Because you
Yeah.
can't solve it right then. You got to sometimes step back a little, relax.
Yeah. That's important as well. And so for my last question, before we say goodbye to you and bring you right back for the Q&A, I want to know, what do you want others to understand about surviving HCC and moving through the journey?
It really goes back to you know getting early detection, which gives you a lot more options. Um, Seeing a doctor on a regular basis, and then researching the treatments they want to do or the condition you have, and just being aware of it. And I always had something like a patient advocate, either yourself or your spouse or trusted friend, to look out and say, is this the right treatment? Can we do something else
Right.
to help you through whatever might be coming up?
Yeah. Yeah, 100%. And so I want to encourage our attendees that are on right now. If you have any question for James, make sure to put it right down below in the Q&A. And James is going to be right back with us at the top of the hour. We're going to say goodbye to James for now, but he's going to come right back and we are going to say hello to Amy Anderson. Amy Anderson is a two-time liver cancer survivor from Portland, Oregon, who was diagnosed in 2018 and again in 2025. She works as a forensics peer wellness specialist for an organization providing mental health, physical health, and substance abuse support to some of her city's most vulnerable residents. She also serves on the city, county, and state committees, advocating for people living with mental illness who may be unable to speak for themselves. Amy's recovery incorporates both Eastern and Western medicine, drawing on her experiences navigating cancer, trauma, and complex healthcare systems. She now shares her story to educate, encourage, and walk alongside others facing their own cancer journeys. Thank you so much for being here today, Amy.
Hello. Hello, everyone. Nice to be here. Yeah.
Awesome. Thank you, Amy. So, Amy, your liver health journey began decades before your first cancer diagnosis.
Yes.
What
Yes.
were you managing during those earlier years?
Well, in 1990, I was kind of unemployed at the time. And so I was donating plasma so that I could help others, who needed the plasma. And during the testing, they came back and said, you can no longer donate because now you have something they called non-A, non-B hepatitis, some formula. They didn't even know what it was back in the 90s. And so I had to wait another 2 or 3 years to get officially diagnosed with hepatitis C, which actively just took over my liver and became the future of HCC. So in the early 90s, there wasn't much conversation about Hep C. They didn't know what to treat you with. And so I was given a really nice liver specialist who was trying to insist that I do interferon treatment. And I
Right.
politely declined and said, no, thank you. I will wait. And so I waited a long time for another drug to arrive. But in 2002, a biopsy was ordered to see what stage the liver was in based on the hep C. So
Right.
in my biopsy, not only did they find hepatitis C had created cirrhosis, fibrosis, they also found NASH, which they now call MASH. So the
Right.
non-alcoholic steatohepatitis was on top of the hep C. So here I had two of those, and my gallbladder was failing. So that added another layer to this puzzle. Is everything was starting to decline. I've been diagnosed with diabetes 2 in the meantime, high blood pressure, thyroid dysfunction, which is now what they call Hashimoto's. And so all of that was happening at the same time.
Wow.
So it became pretty grueling to try to figure out what to do when I was already having so many other doctors seeing me for so many other conditions. So that's kind of how that future became where I am today. Was it
Unreal.
started out in the 90s, and then over time everything just grew.
Yeah. And so I guess when you heard those diagnoses in the 90s and things began to decline, did they ever mention the word HCC, that that could be something in your future?
Yes, the basic trajectory for hepatitis C and NASH is cancer. That is the basic trajectory of what to expect if it's untreated, unmanaged. So yeah, I learned early on what I was facing. And then in 2010, I went to a conference for behavioral health where I was then informed of another condition, which was the complex post-traumatic stress disorder, which, according to the folks who do the ACEs, adverse childhood experience studies, that too had a trajectory of cancer. So the higher your score on the ACE study, the higher the possibility that you could end up with HCC. So there are so many layers to all of
Right.
this that it just became what I was going to say my future.
Yeah. And so
So
when were you first diagnosed with HCC? When did HCC come into the picture?
in 2018 is when okay, let me back up. Because I'd been following doctor's orders, I quit drinking, I quit smoking, I was doing scans every 3 months for over a decade. They were able to find it in its early stages because I kept up with what they wanted me to do. I didn't avoid the scans, I didn't avoid the blood tests. And my liver doctor and I, kind of came to the conclusion that I didn't want to pass away and he didn't want me to either. So when they found it in 2018, they immediately sent me off for a radio ablation because I also needed my gallbladder removed. So they did both at the same time. So they got rid of the cancer, radio ablation, got rid of my gallbladder, and then I began the healing journey from there.
Wow. And
Yeah.
I just I want to backtrack just a little bit
Yeah.
because I would like to know. I knew that you felt like cancer was going to be in your future already.
Yes.
But what was that like when you first received confirmation that, whoa, this has happened now?
I was scared. Okay. I basically have no support system. I have no family. I've been widowed twice. I basically been doing this journey virtually on my own, with basically my doctors being like my family. And so it became kind of a different relationship with everything. I worked a full-time job, But in the back of my mind, I'm thinking, when's it going to come? When's it going to hit? When am I going to be diagnosed with cancer? So I just had to stop focusing on it because otherwise I wouldn't have survived. I had to go into a total different mindset.
Of
So,
course.
yeah, in 2008, the docs had all put me on hospice end of life care for the liver disease from the hep C. So it hadn't even reached cancer phase yet in 2008. And I was already on the end of life list. So I've been fighting really hard to come back.
I'm
Yeah.
glad that you're here with us today.
Thank you.
And I wanted to talk about what they did for you in terms of your first treatment. I remember in the introduction I gave for you, you've survived HCC twice. So
Yes. Yes.
what treatment did the doctors first do for you that got rid of the cancer?
There was only one treatment available, and that was radioablation. And so, basically, I had an incredible team of expert doctors that zoomed me into the operating room and said, we're going to laser it out. I didn't even understand what was going on. I just trusted my surgeon. Okay. This was like way over my head. I didn't get it. And they said, we're going to burn it out and you'll be fine. You'll be up on your feet, in a couple of weeks and back to work. And so it just all went so fast. I just didn't know what to think, because there was no medicine, there was no like chemo, none of that. So I didn't have to do anything involving any other medicine except the radio ablation.
Right. And after you received radio ablation and you were done with that treatment, uh when were you diagnosed again? When did that occur again?
Well, first I have to say that the radio ablation put me into what's known as a 5-year plan of scans every 3 months with contrast, the labs, like the other gentleman was saying. And then it went down to twice a year. And then it went down to once a year. And it stayed that way for 7 years. So for 7 years, I remained completely cancer free. And I always did my scans. I always saw my docs. I spent more time in the doctor's office in those years than I did actually living. So now in October of 2025, I went to my PCP. And because alpha fetoprotein blood tests are part of the norm for diagnosing early cancer appearance, I insisted that my doctor do an early AFP test. And
Right.
so in October, it was October, God, I get so lost, September, October, the test came back and it was over almost 200, which is extremely significant for pre-cancer, for other, cancer patients. And so I immediately got a hold of my liver doctor who ordered another test. And the second test came back, and now I'm in the 300s. And that meant immediate surgery. There was no two ways about it. So within a 30-day time period, I was told, we're now going to have to remove half your liver. And
Wow.
I was in shock. Okay. I was in shock now. I'm like, I had no idea what that looked like, what to expect. I had no support team. I had nobody in my life but me. And I'm trying
Yeah.
to figure out how am I going to navigate a extensive yeah, losing half my liver. So yeah, I that's how it all became in 20 that was last November 2025. Hasn't even been a
Wa-
year yet. Yeah.
Wow. Wow. And
Yeah.
so I wanted to ask you, did you experience any complications following that surgery?
Absolutely. Number one, um I guess during the surgery or right afterwards, my whole entire incision opened up. My heart stopped and they had to revive me. And they couldn't use staples because I'm allergic to metal. So they could not put any metal staples in me whatsoever. They had to use something called surgical glue, and that didn't work because I'm kind of on the large size. And then they put on a wound vac. It's called a wound vac, where it basically allows your body to heal while the material is being sucked into a canister.
Wow.
So, yeah.
Wow.
So
And so I
basically, yeah.
sorry to cut you off.
No, it's
I know you
okay.
mentioned you didn't have a lot of support during
Right.
your
That
treatment
is
and recovery.
correct.
Was there anyone who you felt like was supporting you during that time?
Absolutely. I have a very dear friend. Her name is Barb, and she's a super advocate for healthcare and people. And she agreed to stay with me the whole entire time I was in the hospital. She stayed in the room with me to make sure my needs were met. And then when I got out of the hospital, everyone insisted to send me to a care home, and I absolutely refused. I said, no, I will get care at home. I'll figure it out. I don't want to go to a care home because I won't get well there. I was
Right.
able to secure a nurse to come in 3 times a week to change the wound vac. So that was good. I had that. And then my acupuncturist, Christopher Bonnickson from Acupuncture Center Portland, after working all day in his office treating patients, he came over at night and provided me acupuncture treatments to drain the fluids, reduce the swelling, and keep the inflammation at bay because I also have those other health conditions that are
Yeah.
always in conflict with healing.
Yeah.
So, yeah, it was quite a support system. I was on the wound vac 5 months, and then 2 months later, I demanded to go back to work. And so
Yeah.
I thought, nope, I cannot stay in bed for 5 more months. I was bedbound for like from November to February, and I was like not having it. And so I got myself outside. I don't drive, I don't have support that way. So I have to walk everywhere. I take the city bus everywhere. So I have been rebuilding even now my
Yeah.
strength, yeah, to be
Well,
able to do this.
I'm glad that you've been rebuilding your strength. And I mean, shout
Yes,
out to Barb and to
yeah,
Christopher, who seem like great people and took great care of you.
yes,
Before we get to our very last question for you, I wanted to
yeah.
ask you, how has survivorship changed what you value and what gives you hope now?
It's like this is really hard because when I woke up from the surgery, I said, I feel like a different human being. I do not even feel the same way I did before I went into surgery. And so being alone for a very long time was something I had never done before. It gave me a chance to focus on myself and think about I've been serving my community 30, 40 years, and I thought now is a good time to focus on myself. And so I've taken this time to become focused on what's important for me, my healing, and how that I have to accept the fact I can no longer work full time, but my boss kept my job and allowed me to work part time and has hired another person instead of letting me go. So I'm kind of very grateful for that opportunity to have been given the chance to have your job saved, knowing he had no idea why I left.
Yeah.
Nobody knew, nobody could know why I left. And so it made it even harder on the people I was serving because I had to be yanked out for 5, 6 months.
Yeah.
So, yeah. So
Yeah.
that's what's kept me hopeful is now I have a whole perspective on physical health and the importance of being seen regularly, early, get your liver checked all the time, get your labs done all the time, because the earlier you start understanding what your body is doing, the earlier you can do intervention. And that's what I'm all about is intervention, prevention, education. Yeah, and I'm here
Yeah.
to let people know what is possible, like everybody else
Thank
is
you, Amy.
possible. Thank you.
Well, I'm glad that you're here with us today. Stay with us. We're just
Yes.
gonna have you come off camera. Now we're going to have our last panelist join us before we start the Q&A. I want to introduce everyone to Candace Allen. Candace is 21 years old and currently living and actively battling hepatocellular carcinoma, HCC. She received her diagnosis in early March, and the current hope is that treatment will shrink her tumor enough to make resection possible. Although she's taking time away from work while navigating her cancer journey, Candace remains focused on her education. She's studying to become a medical assistant and spends much of her free time completing coursework, homework, and continues working toward her professional goals. Thank you for joining us, Candace. We're so excited to have you.
Oh, thank you for having me.
Awesome. So, I mean, Candace, I would like for you to tell viewers maybe a little bit about yourself and what was life like before your diagnosis?
Well, I'm 21, so I was before my diagnosis pretty much just working. I work at a elementary school for special needs students, and my life was pretty much hanging out with friends, going to work out, going to do whatever, anything just to keep busy. And then I wasn't in school before I found out, so really just focused on work and just keeping myself busy and having fun time with friends.
Awesome. And so, what made you first realize that, all right, maybe something's going on with my health, something seems off?
So I was actually at work and I was coming off of my break and I sneezed like 3 or 4 times. And then I got out of the car and I started feeling like side abdominal pain. And I thought I maybe like sneezed too hard. I pulled a muscle or something, but it was like kind of constant throughout the whole day. So I went to the school nurse and I asked for her opinion. And then she started touching my stomach, abdomen area, and she noticed that the right side was significantly harder than the rest of my stomach, and she advised me I should go to the hospital. I wasn't really thinking anything of it. I was just like, oh, it's just a muscle, like I pulled a muscle, it's nothing crazy. I didn't even want to go to the hospital, but my friend made me go. So I ended up going to the hospital, and they did CT scans, and that's when they discovered that I had a 9 centimeter mass on my liver. And then I had to be admitted into the hospital because they needed to figure out what it was. So I was in the hospital for about 3 days, 4 days. And then during that duration, I got a biopsy. And then that biopsy then came back to be HCC. And during those, like the last day I was there is when they confirmed it to be HCC. But before that, it was like blood tests, and the doctor is saying, oh, it could be benign, it could be malignant. But the fact that my tumor markers were very, very elevated was the fact that was the reason why they thought they were leaning more towards malignant, and then it came back to be HCC.
Yeah, and when you were in the hospital for a while, they were trying to figure out what was wrong. Did you have anything going through your head of what could this maybe be?
Oh yes, I was going through every worst possible scenario in my head because I was looking everything up on the internet and everything was just negative coming up. So I was like really preparing myself for the worst, and the worst did end up coming back. So that was not fun at all.
Yeah, did they say anything about your AFP?
Yes, that was, I believe, in like the it wasn't like in the 100,000s, I believe. And then when that came back before my biopsy, and then that's when they were like, okay, your AFP levels are extremely high. Like that's why we're leaning towards it being something malignant. We just don't know exactly what it could be. Then that's when they made me do the biopsy, and then the biopsy came back the next day, and it came
Wow.
to be HCC.
So, and I want to ask, because it's not often that we hear 21-year-olds share their cancer journey, specifically with HCC. What was it like receiving a cancer diagnosis at only 21 years old?
It was scary. I didn't know what to expect, and it didn't help also that the doctors, I kept asking them, how could this happen? Like, I just turned 21, barely drank, no cirrhosis, no history of it, no hepatitis. My liver was overall healthy. I kept asking how it could happen, and nobody could tell me. Everybody was like, we have no idea how you got this. You have no history of it. And that kind of made me feel a little bit worse because I'm like, I don't understand how I could have gotten this. And it was just me always looking something up on Google, and Google was not my friend in that aspect.
Right. I think Jerry, who's
Yeah.
the first gentleman that one explained how Dr. Google what Dr. Google can do.
Mm-hmm.
Uh, yes, it's important to stay away from it a bit because it can send you down in a spiral.
Yeah.
So what have your doctors told you? I mean, you mentioned that they just had no answer for you as far as where it could have come from. But what did they share with you in terms of treatment?
So when they first found out, it was end of February, early March of this year. And then it was originally 9 centimeters. And then after the biopsy came back, got my results and everything, they told me that they didn't have the treatment options available for me at that hospital. So I was trying to go to City of Hope, if you know what that is, like a major cancer hospital research center. I was trying to get in there, but insurance just it was like back and forth with insurance for a couple months. So now we're in August. It was started at 9 centimeters, and now I'm sitting at 19 centimeters on my tumor. I just started my Y90 treatment last week, and then I had my immunotherapy my first round of immunotherapy as well. Resection is off the table because my tumor's too big. Same thing with getting a transplant. My tumor is way too big for the criteria to be eligible for transplant. So right now, the goal that they're trying to do is shrink it down enough to the point where they can go in there and just remove it all through surgery.
Right. And you mentioned you just had your first Y90 treatment. For those people or caregivers, patients that are that have a similar diagnosis and have not started treatment yet. Can you take them through what that was like and how you're feeling right now?
Oh, it's very relieving to finally be getting treatment. Like I said, I found out about this in early March of this year, and to now finally be getting treatment, it's a big relief. I'm also still like a little upset because it took this long for me to start treatment, because had I started sooner, I wouldn't have to do all of this scrambling around, and I would have just went straight into the OR to get a resection immediately. But now I'm dealt with limited options, and all I can do right now is just hope that the Y90 and the immunotherapy shrinks it down enough to where the surgeons are comfortable with removing it.
Right. Did you have any side effects after your first Y90 treatment?
Oh yeah, it was terrible for me. I received my Y90 on last Thursday, I believe, and the whole weekend, Friday through Sunday, I was constantly throwing up. I couldn't eat. I couldn't drink any water. Anything I ate or drank would just come up. So I was basically bedridden for like the whole weekend, and it just like constant nausea, headaches, weak, fatigue, all that. It was not fun for me at all. But the immunotherapy, I definitely, it's been a few days now since the immunotherapy, or a week, I believe, since the immunotherapy, and I feel a lot better. I didn't really feel many of the side effects, just fatigue and like a little bit of weakness, but nothing compared to the 190.
Right. And do you have any support right now? How is support like for you? Do you have any family or friends?
Yeah, my friends are very supportive. I spend a lot of time with them when I can, and then whenever I'm in the hospital, they always come to visit me. Same thing with family. I'm very fortunate in that aspect. I also have my boyfriend that was taking care of me a lot through all this, so it's been really nice to have a support system.
Yeah, I think having a support system is essential,
Yeah.
especially when facing a difficult journey. So, I mean, shout out to your family, shout out to your friends and your boyfriend who's standing by your side
Mhm.
and helping you throughout the journey. Since you're still actively facing HCC, what does being a survivor mean to you at this point in your journey?
I would say being able to go every day with like a smile, keeping positive, and having that positive mindset is very important, I would say.
Yeah, yeah, 100%. I agree with you. And if there's any attendee right now with us in the webinar, um, what message would you give to someone who has just been diagnosed and feels afraid of what lies ahead?
Definitely to try your best to remain positive because positivity it'll make you feel better inside and it'll keep you optimistic and to never like give up because there's always hope and there's always something that you could do. And as long as you have people by you that show support, I think it'll make it a lot easier as well.
Yeah. Thank you for sharing that, Candace.
Mhm.
Um, at this time, we're going to bring all our panelists back to the stage before we start our Q&A. So I'll ask Jerry, James, and Amy to join us back on stage. We are going to actually um, begin our Q&A session shortly. But what I do want to do first is do a quick quiz with our audience, which I will launch momentarily. Just allow me a second. Um, so this quiz is just to kind of grasp where you guys are at today and our audience is at today and what they've learned from everyone sharing their experience today. Let me just go ahead and launch it. I don't think our panelists are going to be able to see it, but I'll read it out loud to you guys and one of you can tell me the right answer. So according to today's panel, which statement best reflects the meaning of liver cancer survivorship? One, a person becomes a survivor only after completing treatment and becoming cancer-free. Two, survivorship can include living after treatment, adjusting to life after a transplant, facing a reoccurrence, or actively living and receiving treatment for HCC. C, every person diagnosed with HCC follows the same treatment and recovery journey. Or D, survivorship means that fear, uncertainty, and health challenges are completely over. Um, so to our panelists, which one do you think is the right answer while our attendees try to guess the correct one?
Personally, I think it's a mindset. I
I think
mean,
it's number two, but okay.
Yeah. So I'll give everyone like a minute or so to finish answering. We're at 45% of our attendees have participated in the quiz. Give it one more minute or so for them to answer. I definitely do agree, Jerry. A lot of it can be, mindset. For example, Candace, throughout the time that we've been chatting, she's taught me a lot about being positive and how that can really have an impact on you. So I credit Candace for that. So thanks, Candace. All right, let me share the correct answer. Let me end the poll. Um, so Amy, you are correct. Survivorship can include living after treatment, adjusting to life after transplant, facing reoccurrence, or actively living and receiving treatment for HCC. So you are 100% correct. And I'm going to launch the poll at the very end after we go through our Q&A section. But for now, let me go through the Q&A. We have a couple of questions from our attendees. So let's start right at the top. I believe that, okay, let's answer this question from this gentleman, I believe. Has anyone been losing a lot of have you guys lost a lot of weight during your HCC diagnosis? And that question could be for any of you, anyone who would like to answer.
I wish.
I wish. I actually gained weight.
Yeah, me too. I'm like, I was doing really well until I became bedbound.
Yeah,
I probably
honestly.
lost
Yeah.
45 to 50 pounds from the time I
Mm,
got sick till I was transplanted.
mm.
It came
James, how about
back.
you?
I lost about 75 pounds from a max years ago to diagnosis time. Uh, After that, I'm not sure if it was much.
Yeah.
Practically.
So someone has commented and said, "Wow, my dad has lost 10 pounds in a month." I guess your dad is also facing an HCC
That's a
right now.
lot.
Yeah.
That's pretty
Um,
bad.
I have another question from Wendy. Wendy says, I haven't found social media to be a calming or an educational outlet. It is stressful. I go to the Liver Foundation website and Blue Fairy to be helpful. She had a liver history versus Y90. I had to advocate for myself to get it. Has anyone had that procedure? My tumor was small.
Isn't that what Amy had? Or-
Yeah, I have not had that procedure.
Yeah.
I had that
Uh,
procedure soon after diagnosis.
gotcha. And how was that like for you, James?
I didn't have any trouble with it. You may be a little tired, but it's pretty minimal.
Right. And I think Wendy a little bit earlier, Candace shared her experience with
Mm-hmm.
her first Y90 treatment.
Mm-hmm.
Awesome. So now this is a question for Candace specifically. What type of immunotherapy are you doing?
I'm currently doing Imfinzi and Imjudo. The first round is both of them administered together via IV. And then after that, I believe it's just Imfinzi every 3 weeks, I
Mm.
believe. I believe so. I think that's how it is.
Hey, you're very popular today, Candace. There's another question for you. Candace, are you receiving care at a hospital with MT, multidisciplinary care team?
I'm not being seen at a hospital right. Well, the radiation I received was at a hospital. I I don't I mean, I think it was a multidisciplinary team, but for my immunotherapy, it's more so like an oncology clinic, I believe. It's where my insurance sent me.
Mm.
It's not like a hospital though.
Gotcha. I am going to answer this question as far as if we're going to have another program and the opportunity to share your story. We constantly have programs throughout the year, and we do have opportunities for patients, caregivers, and families to share their stories. So if you would like to be one of our wonderful panelists here, I encourage you to email me. I'm going to make sure I type my email in the chat. And you can contact me and we can chat about any program that you would like to be a part of. Thanks, Billy. Um, okay, I have another question for Amy actually. Your story sounds so much like mine. So you did not have a transplant, just a part of your liver removed. What if I wanted to stay in touch with you?
I am an advocate for anyone who needs me. I'm on Facebook and TikTok. I don't mind. This is what my life is for. Just look me up by my name. I'm not hard to find. Um, Basically, yeah, I don't want to be a doctor, but I definitely have learned how to be a good patient. If
Wonderful.
that helps. So, yeah.
So Amy, once we are done with this webinar, Amy will share her info with me. And once we share the YouTube replay, I'll make sure to put that below in the YouTube video description. So if you guys have any specific links you want our attendees to look at, I will make sure to include them
Or
so
they
you can
can
find them.
email me and then I'll connect them with my links. I'll send them a link.
Awesome.
Yeah,
Um, we have some encouraging messages. Keep fighting, Amy.
thank
Oh,
you.
this question is actually for you, Amy. So, why did you not want to do interferon treatment for the Hep C?
I had joined a multi-panel of people who were already doing it, and everything I read said that it was almost as potent as chemo. And because I had to make house payments and I had nobody paying my bills, I had to work. And the interferon would have taken me out of work and I wouldn't have been able to make my mortgage payment. So that's it. The main reason was financial, but the other reason was I didn't want to look forward to being sick all the time. So that was because I also was diabetic, and that made it really hard to control both conditions at the same time. But I'm glad I waited. I actually ended up with the brand new Hervani, which was even better. And it was 90 days, nothing happened, everything's gone. It was beautiful. So I guess for me, I made the right choice. Thank you.
Awesome. And this is a question I would say if Jerry, you want to take this question. Usually, how long does it take to start with any procedure after you're diagnosed? This person's dad was diagnosed in mid-July, and the oncologist appointment is set for September 9th.
I think that, kind of depends on what they're seeing. In my case, it was pretty quickly because they had already done resection and the cancer came back. And so there was a little bit of a clock running on being able to qualify for a transplant and making it long enough to get one. So I think it really depends on what the doctors are seeing. My first ablation was probably 3 months after my cancer diagnosis, the second time when it came back after the resection.
Thanks, Jerry. Does anybody else wanna take a gander at the question?
Yes. What's very, very important that I would like to share from my experience is I called my insurance company and I said, I'm going through this crisis. I need a team of people or a case manager to manage the administrative stuff you have to get ahead of time, the prior authorizations, the referrals, all the administration things that we can't do as patients. I insisted my insurance company provide me with a care coordinator, a case coordinator, and they were able to talk to the clinics, the doctors. I forced them because I'm paying for it to be my major advocate for moving things forward. I've just got to let people know um I had to go through 6 different types of CT scans and MRIs before they'd even do the surgery. And all of that requires prior authorization and the right clinic. And because I knew the system, I knew who to call. And I said, look, I got to get this done immediately. I don't want to, I don't want to die. Get your people on it. And I'm telling you, if you advocate with the people you're paying insurance with, they will help you. I found them to be very helpful when you explain your situation. So that's what I would focus on for how to move things forward. It's got to go through the insurance company. They have to be willing to pay for it. And you have to make your case say, I want to be here. That's what I told people is I want to live. I don't want to pass away. I need your help now. And that's kind of how I got things done.
The
I
one
just
thing I
got
would
rad. Yeah.
The one thing I would add to that too is everybody with HCC, keep in mind that the quicker you get listed on the
Yes.
transplant list, if that's where you're headed, a clock starts ticking. And after
Hmm.
6 months, you get exception points. And those exception points put you to the median transplant criteria for the MELD scores for your center.
Hmm.
So the quicker you get listed, the quicker the clock starts ticking on those
Hmm.
points. And without those exception points and me moving quickly to transplant after I got them, I wouldn't be talking to you guys. I would have been off the
Hmm.
list quickly.
Yeah, I think it's very important when Amy said to advocate, like try to work with your insurance because, like I said, I found out I had my diagnosis and or early March of this year when it was 9 centimeters, could have got a resection, and now I just started treatment in August, and now we're at 19 centimeters. But I was just
Hmm.
constantly just working with insurance myself. I never advocated like, hey, I need help from you guys. Like I need you guys to get all these authorizations done. So for me, it was just
Hmm.
I had to wait constantly for those authorizations, those approvals, and then it
Hmm.
just got dragged on so long.
Yeah. Yeah. Thank you
Hmm.
guys for sharing. This question is specific to you, Jerry. Jerry, did you take any medications during your treatment?
Um, During the treatment, no, because other than doing ablation to keep the tumors under control prior to transplant. I mean, I did take a couple, I'm sorry, that's not a trend. The couple of things I did take was some medications for fluid because when your liver starts failing, you guys know this, you start building up a lot of fluid.
Mhm.
And so they were giving me a couple of medications to try to keep the fluid off, but that was it. Other than that, it was just keeping the cancer under control with the ablations.
Mm.
Yeah. Yeah, I believe that now this question here is for you, James. Were you continuously active on the waiting list for that entire period, and what was your blood type and exception score?
Well, I did pause myself. I was trying to find employment, and that wasn't happening. Um, so right after I decided to apply for SSDI to help with that part, and that went pretty quick and proceeded to transplant uh, pretty soon. Uh, I'm O positive.
Yeah.
So
Um, and and guess this question is for everyone if you feel comfortable sharing. We have someone who shared their alpha theta protein numbers. They mentioned their dad's is 1001. If anyone is comfortable with sharing theirs during their journey, then that would be really helpful.
I would say keep in mind those are important, but mine never got over 6. I mean, so there was no indication whatsoever I had tumors. If I had not been early detected because of that accident, that would have done me no good.
Yeah. Yeah, I
was
100%.
I believe mines were in like the 100,000s. That was like the main indication that something was not right. I believe it was in the 100,000s.
Yeah. Any advice for any caregivers who have loved ones who are kind of procrastinating their treatment?
Force their hand, get them treated because I said it earlier, time is not your friend with HCC. It's your enemy.
Yeah.
My
Thank you so
answer
much.
would be get them involved to the best of their ability. If they can only manage so much, do what people can manage. Sometimes I think people feel compelled to try to do more than they're able. And so when that happens, seek outside help. That's my best advice for everybody. I've learned along the way, you can't do it all by yourself, and it's good to have a support system other than family. It's good to have a stranger sometimes come in the middle and provide respite so the family members can enjoy each other, kind of thing. So I would
Yeah.
recommend looking at alternative caregiving options within your environment and see what's available.
Yeah, of course. And we have I believe this might be our second to last question. We'll see if we have some time for some more. This is for all our panelists. Did any of you find comfort in your faith during difficult times? Anyone?
Yeah, I wanted to give anyone else a chance to respond first. Yes, I am now an ordained minister. I've been a prison chaplain for over 30 years in our local prison environment long before HCC arrived. And so my faith has been the reason I believe I'm still here. That has always been my guide through everything, is to just know that my faith holds me here. Yeah.
Wonderful. Anyone else that would like to share? If not, I can go to the next question. Okay, sounds good. So I have a question here from Deborah. She's having microwave ablation, but she keeps asking about chemo, but her oncologist is taking it one tumor at a time. Any advice for Amy? Have any of you been in similar situations?
The ablation is fairly effective at eliminating the tumors.
Hmm.
When you get into going into the other things, they can sometimes, from what my doctors told me, I'm not a doctor, but what my doctors told me is sometimes the other things can create additional problems. if they can control it with the something like ablation that's the least intrusive, they don't have to worry about the chemical impacts on your other organs. So that's why in my case, they chose not to do that.
Yeah, in my case, I can't do chemo, but because it was vascular and so close to like a major artery going to my heart, radioablation was the only answer. They didn't want it to spread into my bloodstream. So they just and to tell you the truth, that recovery was so much easier than the surgery. I don't know about you, Jerry, but I recovered within a couple of weeks. And they removed my gallbladder. So it was kind of wow, that was kind of quick, and so I
Yeah.
don't know about you, but I didn't have much recovery time on with radioablation.
Yeah. Now I think we have just time for these two last questions. Did anyone have a problem with bilirubin levels with HCC?
Yes, elevated.
Elevated? Anyone
No,
else? No?
no.
Awesome. What did you do to try to keep those in check, Jerry?
Well, I mean, with me, it was all about how I eat, and it wasn't the bilirubin elevated levels came from the liver disease,
Hmm.
which I had NASH as well, and
Hmm.
my liver was starting having some failure issues, and so the elevated bilirubin levels came from that. And when I had the ablation, I'm sorry, not ablation, when I had the resection surgery, they really elevated because my liver did not crank back up after the
Hmm.
ablation, after the resection. So, but once that was over, and once the transplant was over, it was like everything was perfect, good to go.
Yeah, thanks for sharing, Jerry. And now for our last question. Our son was recently diagnosed with HCC. His AFP is over 17500, and he just got his first immunotherapy treatment and is scheduled for Y90 in early September. Is there any advice that you guys as patients and survivors, anything else he should check into?
I'm just going to add what I've learned for myself that I didn't even realize is that every single food you put in your mouth has an impact on how your liver works. And I found that several food groups inflamed the liver and made it more angry. And so I really found myself like I call it, they're called a functional medicine doctor or a nutritionalist, and they helped me discover what foods were safer to eat to be prepared for surgery or and after. So I really just focused on the diet and made myself nice and strong for surviving. And I learned a lot about food and how it impacts your health. So my choice was to choose a nutritionalist to help me figure out how to mend my liver without causing inflammation other places. So yeah, it's a fascinating learning. I'm still learning.
Yeah.
So
Thank you.
yeah.
Thank you guys for sharing. And I just want to share with our panelists that we have lots of encouraging messages, one in the chat. Thank you for this information. It's been so helpful and in easing their anxiety. And they just want to encourage everyone to keep fighting. Also, someone says you're so amazing, sending you all the love and positive
Mm,
vibes. So just so you guys
thank
know,
you
you
all.
are making a
Thank
great
you.
difference. I want to take the last 2 minutes that we have to acknowledge and thank our sponsors. So thank you so much to our 2026 sponsors, AZI and Merck, for helping sponsor these wonderful Truth About Liver Cancers and are allowing our patients and our community to have a voice and share their journeys and their stories. I also want to encourage our attendees listening in to join our community and support Blue Faery. I will be sharing those links below in the chat for our attendees to see. So our liver cancer community is HIPAA compliant, and it's another place where you can, share your journey, share your thoughts. And as always, we are here for you. I shared my email with you guys, going to paste it again in the chat. If you would like to participate in any program or if you have any questions, please feel free to reach out to me. And lastly, I want to share our poll. This is just kind of a way for us to know who you are, the community that we're impacting. So after hearing today's survivor stories, what is one step that you feel encouraged to take? We would love to hear from you. We would love to hear kind of what you learned and what you will be doing with this information. So I'll leave this up for one more minute or so. And in the meantime, I want to read this out loud to you guys, a comment from one of our listeners. Thank you all for sharing this very valuable information. God bless all of you. So thank you so much. Let's see where we're at with the poll and quiz. Okay, awesome. We've gotten a few answers. Lots of all of the above. So talk with my healthcare team about my care, treatment, or questions I may have. Connect with other liver cancer patients, survivors, caregivers, or support community. Share my experiences or concerns openly with family, caregivers, and healthcare team. And learn more about liver cancer treatment options and survivor resources. So we got lots of people picking all of the above. So this is awesome. I'm glad that this webinar has made an impact.
Yeah.
And again, once again, I encourage you all to look at the resources I shared. Email me if you have any questions. And again, this replay will be available come Monday. So please keep an eye out in your emails. And lastly, thank you to our wonderful panelists for sharing their stories, being here with us today on a Saturday and taking the time with us to be here. So thank you again. And I hope that you have an amazing rest of your Saturday. Thanks, everyone.